Hello everyone. Today we're going to talk about thoracic disc disease. Have you ever heard about upper back pain? Have you had to miss work due to severe back pain? There is no doubt that most of us have experienced back pain or discomfort, and it is a prevalent condition that affects around 80% of individuals at some point in their lives. We knew that with a change in lifestyle and the appearance of particular jobs that put a stress on the spine, spinal disorders would grow. Specifically, disc problems such as degeneration of shock-absorbing intervertebral discs that cushion the vertebrae in the upper and middle back, as well as herniated thoracic discs that can put pressure on the cord and affect the related nerve. In this video, we will talk about the thoracic disc disease, examples of them, the most important symptoms and how to avoid and treat them if they occur. Our role today is to answer most of your questions regarding thoracic disc disease. Today we have Doctor Bae Jun-sok, who is a leading doctor at Wooridul Hospital in Gangnam. He's going to discuss with us everything about thoracic disc disease from an experienced medical point of view. Hi, I'm Umay. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Good afternoon, Dr. Bae. Nice to meet you.
Good afternoon. Nice to meet you.
I'm Umay, and today I'll be asking you a little bit about what you do. And I will go straight to the first question. So I'll be asking you about thoracic disc disease. What is exactly a thoracic disc disease?
Thoracic disc herniation is a condition similar to a herniated disc in the neck or back. Just as cartilage fragments from the lower back protrude, we are talking about diseases in which cartilage fragments protrude from the back and pressurize the nerves.
Are there usually any symptoms that show in a person who has thoracic disc disease?
The most common symptom is back pain. So the pain between the bones is very severe, especially in the middle back. So it is a very common symptom to suffer a lot from the pain, even when sleeping while lying down, or pain running down the side of the body. When things get a little bit more complicated, you have symptoms that are very similar to herniated discs. It is a case in which the leg feels pulled, numb, or even has difficulty in walking or urinating.
So what is the diagnosis that is used for this disease?
The most accurate diagnosis method is to take an MRI which can show whether there is a disc or not. Even with the initial examination, a CT scan can be performed to determine whether the disc is hardened or still soft, and the treatment will be changed accordingly.
So in all cases, you have to do a surgery or not?
The most basic treatment is injection therapy or physical therapy. If the pain persists for more than 3 months, the pain causes severe pain to the extent that daily life is almost impossible, or there are paralysis symptoms. Then surgery is considered.
So in what cases the surgery is a necessity? There's no other options but the surgery?
The most basic treatment is surgery, but in the past there are a lot of big problems in order to perform thoracic spine surgery. Because the neural tube is very thin, and there are very important organs like the heart and lungs near the nerve. So there have been many times when we had to decide that it was impossible to treat. So the treatment that we can do in the stage before the operation, where the incision is made under anesthesia, is a method of treatment with a thoracic spine endoscopy.
So usually before surgery, what kind of things should be considered from the patient?
What patients worry a lot about is the complications of the surgery. It is the experience of the doctor that is the most important, how accurately and precisely the operation was performed. In particular, various endoscopic instruments, following thoracic surgery and navigation equipment that can safely perform thoracic surgery are very expensive. It is very important that they are well equipped with expensive equipment and the doctors have a good, long-term, stable experience with this treatment.
So is there a certain behavior a person can follow in everyday life to prevent this disease?
When it occurs due to degeneration age, it is a case of accumulation for a very long time. But in the case of a thoracic disc, it can occur to a lot of young people. The reason is bad posture. Especially when you work out a lot and carry a lot of heavy weights, these things repeatedly stress the thoracic spine. One of my patients, for example, is a bodybuilding champion, who has had very severe thoracic disc and is one of the most memorable patients. I know it is not considered a sport, but the repetitive stress caused by lifting a lot of weights is what puts a lot of strain on the body, ultimately causing this disease.
So you're saying that age can affect this disease and also the kind of sport you do. So for everyday life, for example, what are the things you should avoid apart from these two?
As with other spinal disorders, the repetitive act of bending and lifting heavy weights is the worst. So on the contrary, exercise methods that straighten the back and strengthen the core muscles can strengthen the back muscles and those surrounding it. So it is a way to prevent thoracic disc. Conversely, lifting heavy objects or exercising more than the body can handle with bad posture are the causes of thoracic disc.
So can you say because of lifestyle right now, because people keep sitting in a desk every day and don't move, does that affect the likelihood of getting disc disease?
The most common thing we know is that a herniated disc or neck disc can also occur when sitting at a desk for a long time and in a bad posture, with the head bowed down a lot. In the same way, the back is also bent and pressed continuously. So such postures can have a great impact on the back disc and cause disc formation.
Today we learned many things about thoracic disc diseases, example of it, what are the symptoms that accompany it, and how can we avoid and treat it. Thank you for joining us once again at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.